Good morning, everybody. It's Wednesday, the 29th of April. It's good to be back after a few days off. Just on a personal note, Pat and I have completed our move to Wesley Chapel. And of course, we chose last Friday to move. It was a monsoon. And it made for a very difficult and very wet move. But we spent most of the weekend trying to get things sorted out. I was the smart one. I got to come back to work, and I left my wife to finish the unpacking. So it's very good to be back at work and doing something other than packing. We'll go ahead and get started with our daily report, and we're going to turn first to our board. All right, we're going to start first by looking at the comparative statistics for the state of Florida. You can see we have 32,848 confirmed cases with 1,171 deaths. That's a fatality rate of about 3.56. To date, we have tested 368,000 Floridians. That number is rapidly escalating. You may recall the last time I showed you this graph, it was just at 100,000. So we've been able to quadruple that number in just a short 7-day period. Interesting enough, the Department of Health and the National Guard were on our campus last Friday, and they were able to do random testing over at our skilled nursing center for both staff and residents, and that was a positive change. We're beginning to get a handle on COVID testing, and the antibody testing is soon to follow. Here are the numbers for the Pinellas County. We have 709 confirmed cases with 31 fatalities. Just comparing the overall fatality rate for Florida, it's 3.56. For Pinellas County, it's 4.37. The other thing that is really important for us to look at is the tracking of our available healthcare beds. This is important because the stay-at-home restrictions do two things. Not only do they prevent the spread of coronavirus, they also are there to ensure that the hospital system is not overwhelmed. We currently have 3,307 staffed beds, and they consist of ICU beds of 285, that's intensive care beds, and then we have 3,874 long-term care, rehab, and general hospital beds. So you can clearly see that our capacity has not been overwhelmed. And just some anecdotal information to share, Meese Countryside, who is the primary COVID hospital for our area, their capacity is currently only about 50% occupied. So we really have Pinellas County and the state of Florida have done a great job in making sure that available medical resources are there and that we have access to them for COVID patients. So this next chart that we're going to take a look at is really some good news, and we've all been waiting for some good news. This is a chart of the daily confirmed new cases reporting at hospital, and it's over a 5-day average. This is the map for the United States, and our color is here in green. And you can see where we had the spike, and then somewhere around March 26th to March 29th, we saw a leveling off or a flattening of the acceleration. You have now seen, look at here at about April 11th, at about April 15th, at April 26th. If you were to take a look at that, you can see that there is what is called the downward projection. Yes, there are peaks and valleys, but the downward projection is fairly clear. So we are on our way out of this. We still need to be diligent, but the curve has been broken and there is light at the end of the tunnel. All right, I thought it might be interesting to update you on how we're doing here at Regency Oaks. We currently have 15 residents who are under quarantine. The 9 of them are over at the health center and 6 of them are here at the independent living. The 6 individuals who are under quarantine at independent living are either new move-ins or people who have returned from the hospital, and they are not suspected of having any flu-like or COVID symptoms, but post-hospitalization or post-move-in, we are requiring an isolation period. In terms of residents and staff that are displaying either flu or COVID-like symptoms, we currently are not tracking anyone, so that is really good news. And our confirmed cases, we continue at 1 confirmed resident, currently in the hospital, improving, getting stronger, doing well, and no employees have been affected at this time. So those are the statistics, and I know this has been sort of heavy on the graphs to date, but I want to go back to some charts and graphs because this statistical data I think you may find useful. So a little less on-camera time for me this morning, but I think you'll find this information informative and helpful. So we'll go back to the charts. The White House has unveiled guidelines for opening up America again. It is a 3-phased approach. It's going to be based on the advice of public health experts and White House officials. These steps will help with the state and local officials in terms of deciding when to reopen their economies, get people back to work while continuing to protect lives of Americans and Floridians. The proposed phased approach is based on up-to-date data and the readiness of the state. It's why we track all these numbers, is because we're looking for certain trends. The phase 1 will mitigate the risk of resurgence. We don't want to reopen so soon that we see a spike and a reinfestation of the virus back in the population. The phased approach is designed to protect the most vulnerable members of society. Regency Oaks was one of the first to impose sanctions. We will be one of the last to remove sanctions because of our population, which is high risk. And it's going to be implemented on a statewide basis, but it's at the governor's discretion as to which county will be lifted county by county. And so if you look at Hillsborough County or Miami-Dade, which have been hot spots here in the state of Florida, they would open after Pinellas County or Pasco County, which has better numbers. So that's the outline of the phased approach. What I'd like to share next is the requirements to enter the first phase. In terms of our symptoms, we would have to have a downward trajectory of influenza-like illness, that's flu, for a 14-day period. And additionally, we would have to have a downward trajectory of COVID-like symptoms reported for the same 14-day period. So both flu and COVID cases must be down for 14 consecutive days. Now, it's important to remember it's a downward trend. You'll remember on the first graph, we showed you that there are spikes, peaks, and valleys, and that's allowed but it needs to be a 14-day downward period. We are probably, we have met the first requirement. We have 14 days here in Pinellas County of a downward trend. The trajectory for the COVID is more like 5 days, and we'll continue to monitor that. The cases, these are new cases reporting to hospital. There has to be a downward trajectory of documented cases and a downward trajectory of positive test as a percentage of total test. And so that's when you present at hospital, they have to make that determination as to whether it's flu or COVID. And so it's a downward trend in both cases. And then finally, in hospitals, we have to have the ability to treat all patients. The final criteria that would have to be met is with our hospitals. We have to have the ability to treat all patients without creating a crisis, and we've demonstrated that we're there. And then robust testing must be in place for at-risk healthcare workers, including the emerging antibody testing. So the testing program for at-risk workers is in place. It's doing very well. We are not yet at the point where we're looking at the emerging antibody testing. That is scheduled to come to Florida around May 1st, and that has to be in place before the governor will enter into phase 1 removal of restrictions. All right, so that sort of concludes our report for today. A couple of things I'll leave you with. On Friday, we will start to roll out what that phase 1 is going to look at here at Regency Oaks and how that's going to impact our service delivery in dining, housekeeping, maintenance, transportation. We've been working with our corporate partners and have developed a 20-page plan, so look for Friday to be lots of good information about when that is or how that is going to happen. You'll want to be sure to catch Governor DeSantis's press conference today. He is going to be announcing exactly how he is going to roll back the restrictions, and so we're anticipating getting some good information there as well. One last thing that was an article that was in the Tampa Bay Times over the weekend. Eric Rout shared this with me, and so thank you, Eric. Really good information. We have known for some time what the telltale symptoms of COVID were. It's the high fever, the loss of appetite, the loss of smell and of taste, potential diarrhea. So those are the usual symptoms. There has been a recent study from the Scandinavian countries where they looked at the differences between individuals from the high-risk category, those over the age of 65 with one or more chronic conditions and higher risk factors, to determine if they are showing the same symptoms when they present at hospital. And in fact, they have found that these are not typical symptoms. They're not atypical, but they are not typical symptoms for seniors who might present. Additional diagnoses that they look at for seniors include a altered mental status, delirium, recent falls, fatigue, low blood pressure, painful swallowing, fainting, nausea, vomiting, and abdominal pain. So I mention that only to advise you that the typical symptoms that you hear all of us talk about may not be all inclusive for the senior population. There may be some additional symptoms that you need to be aware of. And so if you present or start to see any of these symptoms that you're concerned about, please be sure to reach out so that we can do a wellness check. One of the keys to making sure you're safe and the rest of us are safe is our early diagnosis and prevention, where if we can get you the medical attention you need, the severity of the COVID exposure is less, and your likelihood of getting through it is greatly increased. So thank you very much for tuning in. I hope you got some good information. Again, it is great to be back at work. My back is in one piece, and I'm getting used to the daily commute. So have a great day, and we'll see you again on Friday.